Storytelling is incredibly important because it really brings a human light to very complex medical issues. We can provide statistics and data, but people tend to forget those numbers. It's really the stories that they remember. It's how you make them feel during the moment that really sticks with them and gets them to take action later on.
We have to be able to bring it down to a local and even an individual level so that when we talk to people, they hear it, they feel it. So telling stories with a clear beginning, a middle, and an end with an ask about whatever issue matters. And I think as we learn to do that more and more, we will connect more with people. We will connect with people that don't quite understand us because of that individual story.
In today's Courage is Contagious session, we talked about the importance of storytelling and how that's a very powerful and effective advocacy tool to get members of Congress to support our ID and HIV priorities.
We had a panel of these amazing experts who talked about their story in advocating, whether it's for HIV, whether it's for antimicrobial resistance, and we discussed how do we be more effective in telling our stories. What is our single overriding message? Where is that going to be? And how do we incorporate these different stories, whether it's I'm in my clinic taking care of an HIV patient who's scared, who's asking for all their HIV meds for a year because they're not sure they could have that in the future because of the cuts. These sorts of individual and being able to tell that story matters. And I think this session really, not only helped us think through some stories, the next stories we're going to tell, but also just inspired us to go out and advocate and have the courage to advocate, especially right now.
Any member can get involved. You don't have to be, someone like Dr. Peter Hotez, to get involved in advocacy and to do advocacy on the Hill. One of our speakers today is a third-year ID resident. She's very early in her career, but she talked about, going to Capitol Hill in Washington, D.C. and meeting with, her congressional representatives and also meeting with her representatives in district as well. So I'm hoping members can really take away that anyone can do advocacy. It's for everyone, and they can do it whether they're in DC or at home.
I hope the attendees of this session, number one, are inspired. Number two, that they realize they're an advocate every day, whether they're a physician, pharmacist, nurse, administrator within infectious diseases. They are such a trusted resource. They're considered one of the smartest healthcare providers. We're all advocates. And I think that our group needs to hear that. I think thirdly, we had a lot of discussions about how we need to talk with the public more and be better listeners of the public. And in that listening and in that conversation, you can tell the stories. We can tell the public our stories. They can tell us their stories. And in the end, you have this collaboration that leads to advocacy that will be better for our patients. This session inspired a whole heck of a number of people to go out and, one might say, fight for what's right within healthcare right now. This is the time, maybe more so than ever, to really make sure we're advocating for all these things that have made us have healthy lives.